Dr. Liz Dylke, who I've worked with for over a decade at this stage. She's a physiotherapist who leads the Cancer Rehabilitation and Lymphatic Disorders Research Group, and is also the Vice President of the Australasian Lymphology Association. Her particular area of focus is in the assessment and management of lymphedema secondary to cancer treatments. Over to you, Liz.
Thanks very much, Patrick. I think it's great to be following Jo because so much of particularly the strategies she recommended at the end for cognitive fatigue actually apply really well to a lot of the things that we'll talk about for overcoming some of the challenges, the physical challenges introduced by the side effects of cancer treatment. So work is really a physical endeavor, and just as we consider how to safely start or return to sports, a similar process should be considered for work. To be able to work well, the requirements of the work activity have to be met by the physical abilities of the individual, and particularly in light of any physical or functional changes that have developed with or from your cancer treatment need to be pulled in and considered in planning your return to work. Obviously, this is a very large and individualized topic to try to discuss in this type of forum. Every work role, every work environment is different, and each will have its different challenges and considerations to overcome. Furthermore, the individual side effects that may be experienced differ between different cancer types, between different cancer treatments, and of course, between different individuals. But as we've heard, we know that there are benefits to work, but the physical barriers to rejoining employment or seeking new employment do often exist. And I think it's important to talk about what these physical side effects might be. We've heard and we've seen in the research that some people believe that these side effects are unavoidable consequences of cancer treatment, and so don't raise them with their treating team or seek assistance for them. However, this is frequently not the case, and there are management strategies that can be put in place to at least prevent worsening, but more frequently to improve or reduce these side effects. The treatment for cancer can have a number of physical outcomes for patients, all of which can have an impact on the individual's ability to undertake their work roles that they want or have to do. And it's important to note that most patients won't experience all or even many of these side effects, but many patients will experience some of the side effects. And these can last for a short time, or for some of them may present for long periods of time. If we think about the different categories of side effects, I've tried to break down what we frequently see together. So there's some side effects from the treatment for cancer that are related to the physical conditioning. This can be things like that physical fatigue that goes along with but different from cognitive fatigue, deconditioning caused by treatments and lack of activity, and shortness of breath. Other physical side effects from cancer that we see are related to movement. And so we often see, particularly after things like breast cancer, restrictions of movement of the shoulder. And after many other cancer treatments, we may see pain and weakness of certain muscles or muscle groups or joints. There's some side effects that are related to swelling, whether an acute swelling presentation that will go away, or a permanent swelling like lymphedema, which results from the disruption of the lymphatic system and may not go away. And finally, then there may be other issues related to the way that you feel things or the way things feel to you. And some like fatigue and pain are relatively common across many cancers, while others such as lymphedema are associated with specific cancers. But open communication, as has been mentioned before, about these issues or things that you're experiencing and seeking out rehabilitational assistance from allied health practitioners like a physiotherapist is actually a really important step in reducing the impact of these side effects. They'll work together as a team with you and your employer and larger support group to address the individual side effects, and that will often use a combination of different treatments. Exercise, including general physical activity, as well as exercises that are specific to the side effect that you're experiencing, have been demonstrated to be beneficial for most, if not all, of these side effects that we're talking about. These exercises, as well as a bigger treatment plan, should also really consider your work requirements and how these side effects may be impacting your work roles. We've heard a couple of times already, so and it's not saying anything new, but work is a really complex activity, and to be able to return to or continue to work as well as possible in light of these physical impacts that we've just talked about, you need to really think about the work role quite holistically. So everything from what you need to do to prepare and to commute to work, as well as the tasks that are undertaken while working, may need to be broken down to understand how the impacts of cancer will impact on your ability to work. For most people, work consists of a series of activity or tasks, including some that are done frequently, and some that may be modifiable and some that may not be modifiable in response to any physical limitations or side effects from cancer. So to help be as successful at work as we can, we'll often start by looking at the tasks that are done frequently. This could be anything from the need to sit for long periods of time, or to lift repeatedly, or to be standing for long periods of time. And then when we align that with the impairments being faced, we can start to look at the strategies and exercises that might be useful for assisting you to do those activities that you need to do. And part of that will be breaking down what aspects of it are hard to modify. So in a job that requires a lot of lifting, removing lifting responsibilities may be difficult to do. And while then you might also look at the things that can be modified, like sitting, to look at other strategies to break up sitting, to support limbs that are uncomfortable with sitting, and or to change to different positions regularly. So thinking about work and the physical side effects and their interaction gives us a way to put strategies in place to help you work well. So what can we do to help overcome these physical challenges that may be presenting from your treatment for cancer to help you return or work well? So the first thing is really to act early. If you notice any physical side effects developing, whether it is pain or changes in the way a body region feels or is moving, shortness of breath, swelling, get them assessed and treated as soon as possible. So seeking out assistance from a rehab professional, allied healthcare practitioner can be really useful. But because they can be quite complex and there can be multi-causes to it and multi-interactions with your workplace in particular, managing these physical side effects and managing them in a work environment often requires a multidisciplinary team as well as a multi-pronged approach to treatment. And so we often use strategies that align the needs of your work tasks with the challenges with the side effects. And sometimes we have to be quite creative in looking for solutions to try to overcome specific challenges. So an example of this is some work recently done by one of our master's students who looked at hand lymphedema, which is a swelling that occurs in the hand secondary to treatment for breast cancer. Now, the normal management for hand lymphedema is a compression glove, which is not appropriate to wear in all work environments. But kinesio tape, which is this colorful tape you can see on the screen and is all over the athletes at the Olympics, is suggested to be able to move fluid out of an area. And so we trialed a system of wearing the kinesio tape for 48 hours in place of wearing the normal compression garment, using a pattern that was relatively easy to apply and could be applied by a patient quite easily. And we are quite pleased to find out that, this different approach to treatment resulted in no increases in swelling, no changes in the way the swelling felt when worn for 2 days. And so this could represent an alternative approach to treatment in those who couldn't wear a compression garment in their work environment. So finally, exercise is going to be a critical component of your management plan to both manage the physical side effects from treatment and to prepare you from work. Exercise is really critical through lots of stages of your treatment and beyond to help prevent some side effects and limit the impact of others. And I'm excited to have Jazz talk to you more about that next. Thank you.